Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. I'm back with another NMC OSCE video for you. So if you like my videos, please press the like button now. I really appreciate it, and subscribe to my channel. And keep those comments coming, okay? Keep that feedback coming. I do honestly look at it and I try to answer as many questions as I can possibly do for you. And I hope you're finding these videos really useful to revise for your OSCE, and hopefully they're going to help you to pass your exam. Okay, so do like and subscribe. So today's video. So what we're going to do in today's video, as you can see, I've done last few videos on assessment station, like what kind of different patient scenarios you can get, and giving you a little bit of guidance on how to run those scenarios. So today we're going to look with high demand now. You've been asking me this for a long time. So we're going to look in neurological scenario, okay? So you can get a neuro patient in your OSCE and how to run that scenario, okay? So that's what we're going to look at. I will tell you what you are supposed to do, what are you expected to do in these 20 minutes, and a little guidance on how to run the scenario, what kind of be the possibly nursing needs of this patient you can discuss in holistic assessment, okay? So that's what we're going to look for. Right, so let's get started. So first screen, it is it's your assessment station, so it is 20-minute long, and you will be given a scenario to read, okay? But there is no extra time for reading that one page of information. You have to read that within your 20 minutes, and I suggest you read that as soon as your timer starts. Read that to yourself, not to the examiner, not to the actor, the patient I mean, just to yourself, to get better understanding about the patient symptoms and diagnoses and everything else. So we call this patient history form, overview of recent history form. So as you can see on your screen, you get something like this. Means this does not belong to any real person or does not reflect a scenario in exam. It's just something, just a simple scenario for a neurological patient which we can come across on the wards. And as we know, like if you look at NMC's exam scenario list, there is a neuro scenario for subdural hematoma, which the topic is subdural hematoma. So I just thought, yeah, this scenario, okay, the patient is, as you can see, is coming with worsening headaches, nausea due to subdural hematoma, okay? And they could have other presenting complaints alongside it, which are caused by the subdural hematoma. Now they might have a bit of confusion, they might have they might be a bit unbalanced on their feet, so they might have a risk of fall, and nausea and headaches. Obviously they might not be able to get good sleep because of headaches, so all this stuff. So, and then you can see you get presenting symptoms, then you get diagnosis, and then you go, they have their medical history on that form, then also tells you about their ID details, allergy status, also tells you about their social history and the medication they are on at present, okay, before they came into hospital, what medication have been taking at home. So that's all. You just get a little overview, okay? So this is overview, this is not detailed. You are going to do a detailed assessment, but this is just overview of the recent history, what's going on with your patient recently, okay? So it's a very good information to read and absorb, so you can actually use that in your assessment station. And you don't need to put this form down. You can use it and look through it all through your assessment station, especially when you're doing holistic assessment of your patient. You are not you're not expected to remember everything, memorize it, but you can again look at it later on when you need it, okay? So next screen, what do you need to do in 20 minutes? So because this is an assessment station, so you are going to start the station safely, like you know how to start every station, so I'm not going to go through that. But main themes of the station is that it's assessment, so you will have to take vitals. Without doing vitals, we can't assess clinically per patient. So take full set of vitals, like your blood pressure, your saturation, capillary fill, heart rate, respiration, and temperature, okay? So that's the whole set of vitals. Then you also need to complete the neurological observations. Whether you complete before vitals, after vitals, is up to you, but you do need to complete it in this station. So that's like doing patient Glasgow Coma scale. pupil size and reaction to light of the pupils, and then limb strength assessments for the upper limb and lower limbs. It means for your arm strength and your leg strength. Okay, so those are the neurological observations. So Glasgow Coma Scale, pupil size and reaction to light, and the limb strength assessment for both arms and legs. So that makes your neurological observations. Then within 20 minutes you need to complete the Glasgow Coma Scale chart, which is, it's not GCS chart, it's a neurological observation chart. So you GCS is part of the neurological observation, but you complete the neurological observation chart. Okay, and then you also need to conduct full A to E assessment of your patient, because it's an assessment station. So that goes without saying that you still have to complete that as assessment marking criteria. Then you also after that need to carry out the holistic assessment of your patient nursing needs. That is means physical needs, psychosocial needs, and spiritual and sexual needs. Okay, so that has to be looked at within the 20 minutes. Now next thing is, what document do you get? You get overview history form to read, and then you get the only document you complete is the neurological observation chart, which is the you complete. And then on the neurological observation chart there are sections for neurological observation and vitals as well. So you plot everything. You are not going to get news chart in this scenario. So you are going to get neurological observation chart, and in neurological observation chart, as you can see, you have patient details. If you don't know how to complete this chart, watch my video on the neurological observation chart, how to complete it. I've already done the video. I will attach the link of that video to the description of this video below. So in your neurological observation chart, patient details go on the top. Then there is a section for the Glasgow Coma Scale. Then there is a section to plot your temperature, blood pressure, respiration, pupil size and reaction to light, respirations, oxygen saturations. Then is the pupil size and reaction to light, and then your limb assessments for your arms and legs, and also then your total GCS score, and then your initials at the bottom. So make sure you exactly know how to plot that chart, and like I said, go and watch my other video and I will go through step by step how to plot that. Okay, so that's that. So and then obviously so that's all has to be done within 20 minutes, taking vitals, taking neurological observation, plotting everything on the neurological observation chart, doing A to E assessment, then also doing patient holistic assessment, looking into their nursing needs. So looking into their physical, psychosocial, spiritual, and sexual needs. So that goes without saying, because that's the whole theme of doing assessment on someone. Okay, so that brings us to now, what are the common themes? Okay, what are the most common nursing needs you can discuss with your patient in holistic assessment? Because you can do the rest, because it's not anything different, as long as you know how to complete the neurological observation and how to plot on the neurological observation chart. And A to E assessment is not anything different, is as per the marking criteria, and vitals you take in any assessment station. Okay, and plot them on the chart. Now what are the possible nursing needs? So let's look at that one then. So if we look at possible nursing needs, and I'll discuss a little bit here. So pain is a different kind of pain here, isn't it, in neurological scenario, because the patient is experiencing headache. Okay, so it is still a pain, so you will verbalize that, you will assess the pain score, you will give them regular pain relief. Yeah, but also what else we can do for headaches? Okay, because it's just not like abdominal pain or anything. We probably can do a lot more for headaches: dimming the lights, keeping the lights down, reducing the noise level for the patient. If they are in a obviously you can offer them a sleep pack which have an eye mask and the ear plugs. We have those in hospital wards, so you know all that. So looking at that, so what can trigger a headache? Ask your patient what can make their headaches worse or better, and then you can look into those triggers and avoid those. You will verbalize, and you will verbalize that you will do their risk assessment, pain assessment, give them regular pain relief, and then also look at some deep breathing and another relaxation techniques you can advise your patient. And also, like I said, look at what else can trigger a headache, whether reducing the light will be helpful, reducing the noise will be helpful, giving your patient a comfortable, calm environment to have rest will help with headache. Okay, so think about those things. Then nausea is another thing which subdural hematoma can cause. So you look at it, ask your patient, are they nauseated at the moment? Have they had any medication? Reassure them that you will give them regular medication to control the nausea, so they can then start eating a little bit, and then having sips of fluid might help. So and you will offer them diet and fluids as tolerated because of nausea, and you will keep an eye on it, how they're doing with nausea. And reassure them that you will give them regular medication as prescribed by the neuro team. Now, mobility. Sometimes subdural hematoma can cause a bit unbalance, and then you need to make sure that your patient has the cold bell, help them with mobility so they don't fall. Think about, is this patient at risk of fall? So then you can think about the fall prevention. So you can mention that as well. And also, when you do the Glasgow Coma scale, you're going to ask about the confusion and work out if your patient is confused. So that's another thing you need to think about. Is your patient confused? Can they follow your instructions when you're giving them the instruction to say press the call bell and I will come and help you with mobilizing? So remind them again and again. If they're confused, they may not be able to remember that. Okay, so you may have to check on your patient quite regularly, because if they have confusion and if they have already risk of fall because they're feeling a bit unbalanced on their feet because of the subdural hematoma, then you do need to look at risk of fall. Maybe think about putting the bedsides up to keep your patient safe, but after patient consent. Okay, take consent for that. Then those are the kind of physical needs. So pain, nausea, mobility, risk of fall. You can look into, is nausea causing them a problem with reduced oral intake? Can they be malnourished? So you could think about that. So it's just possible nursing needs. I'm not saying you're going to discuss all of them, but it's just giving you some things to think about. Okay, if you can go through 2-3 out of them, that'd be enough. Okay, but even if you can go through 2, then that be enough. But I'm just giving you examples. What can you come across? Okay, then do look at their emotional needs. Psychosocial means, are they worried? Is there anybody at home they want you to contact? It can be quite fearful having some subdural hematoma because they're suddenly getting a little bit confused and all that. So just see what family support they need. Can you call a friend or a family on their behalf? Spiritual needs, do they have any spiritual needs? You can help with them. So that's all goes in there. And then obviously, do they have any preference to male or female carer to protect their sexuality when you're giving them, helping them with personal care? So you can look into that as well. So that is your holistic assessment. Okay. So I hope this give you a little bit of a better understanding of the neurological scenario, what you need to do. But like I said, you need to watch another video alongside it. Okay, so you do need to watch the video how to complete the GCS. There is a video on obviously how to complete that bit by bit, and then on A to E assessment there is a video. I will add the link of the video to the description of this video. So if you can do those things, plus now you know what kind of nursing problems you need to discuss with them. Hopefully now you have better understanding of this scenario and you can do this correctly in your exam. So if you like this video, please press the like button now and subscribe to my channel. Also, you can visit us on OSCEnurstraining.com. We provide online, face-to-face, combination of the both online and face-to-face. If you can't attend whole week of face-to-face, then you can decide to do half online and half face-to-face. The option is available as well. We do also resit training as well, for if anybody is struggling to resit stations and they haven't had training before, or they had training but now they are having problems. So yes, so we do that as well. So you can email us on OSCEnurstraining@outlook.com. I will soon be back with another video for you. So bye for now.